Let's talk about safe use of medication. This is a really important topic and one that a lot of people have questions about. So there are three kinds of medicines. There are medicines for symptoms like a cough, there are medicines for infections like antibiotics, and there are medicines for chronic conditions like high blood pressure. And it's really important to understand that we should use each of those medicines for different lengths of time. If you have a cough, you can use cough medicine like Robitussin or whatever cough medicine you like, and you just need it for a couple of days, right? Until your cough gets a little better. If you have a headache, you just need to take that medicine as you need it if you have a headache, yeah? Then there are medicines like antibiotics, amoxicillin, azithromycin, doxycycline. Those medicines only work, just like all the anti-infectives, including antifungals and antiparasitic agents, they work by killing bugs, not by reducing symptoms like the other medicines we just talked about. So it's really important to take your antibiotics or your anti-infection agent of any kind at the right dose to kill those bugs and the right length of time to kill those bugs. You can't just take one amoxicillin for a cold. It doesn't work like that. Those medicines need to stay in your system, sometimes for 3 days, sometimes 5, sometimes 10 days, and even longer, so they fight off those bacteria. Because if you think about it, the strongest bacteria are going to live the longest. So when you take that first couple doses of amoxicillin, you're going to kill a bunch of bacteria, but there's going to be some fighters in the back of the room, and they are not going to be killed by that amoxicillin. That's the reason we need to keep taking it day after day for the prescribed length of time, because science has learned how many days of a certain anti-infective agent we need to take it to kill all the bad germs in our body. So that's why it's so important to take antibiotics for the right length of time. 1 dose, 2 doses, that never is going to do the job. That's the way you take symptom-based medicine, which are never anti-infective medicines. Amoxicillin is not a symptom medicine. Paracetamol is. The last kind of medicine I want to tell you about is medicine for chronic conditions like diabetes or high blood pressure. Those medicines have to be taken every day because chronic conditions don't get cured. You can't fix them by taking 1 or 2 doses of a medicine. You can't even fix them by taking medicine for 2 weeks. So if you have high blood pressure or you have diabetes, it's really important to take your medicine every single day. I know it's hard to get. If it's blood pressure medicine, often it's better to change the type of medicine you're taking than it is to go without for a really long time. So it's important to know those 3 different kinds. I want to go back again to medication resistance. That happens with antibiotics and anti-infection agents, but in particular antibiotics. Antibiotics treat bacterial illnesses. They don't treat viral illnesses. And so if we use amoxicillin or azithromycin to treat the common cold, which is a viral infection, we're wasting our azithromycin. Azithromycin is something that we need for pneumonia, and we need it for sexually transmitted infections. And sometimes we need it for diarrheal illnesses. If we take it for reasons that we don't need it, we're going to get resistant to it, which means it won't work to fight the bad bugs when we need it. So it's incredibly important for each person to take their medicines the right way to protect themselves against antibiotic resistance. And it's important for us to teach our students and their families about this because that prevents antibiotic resistance in the whole community. If we all take our antibiotics the right way, the community at large will be healthier.